Hello everyone, welcome back. Today we are going to be covering chapter 11 of the Cooper book, which is on positive reinforcement. These are the different task list items that we will be covering from the 5th edition task list. We'll be covering some concepts and processes, which is section B. And we will also be covering some behavior change procedure task list items. And then from section H, we'll be talking about some of the possible unwanted effects when using reinforcement. So what is positive reinforcement? You guys have heard this before. You should have had some exposure to it in your intro to EAB course. And you also heard me talk about it a little bit in our first lecture of this course. So positive reinforcement is when a type of behavior, whatever behavior it might be, is followed by some form of reinforcement, which then results in an increase in the future probability of that behavior. And we're going to break down what this means, right? But there are 3 different qualifications necessary or conditions under which the effects of reinforcement are going to occur. So we need to consider, how quickly after a behavior occurs is that stimulus coming, because this is going to affect whether the behavior increases in the future or not, or whether that stimulus is going to function as reinforcement or not. We also need to look at the relationship between the stimulus conditions that are present when the response was emitted. And then finally, we are going to be looking at the role of motivation, because motivation plays a very big role on whether or not something functions as a reinforcer. Right, so these are some of the things that we're going to be looking at throughout this lecture. All right, so as a form of review, let's look at the definition for positive reinforcement. Positive reinforcement is when any response is followed by the presentation of a stimulus, right? We are adding a stimulus, and then that addition of the stimulus results in an increase in the future probability of those responses, right? So another definition is the addition of a stimulus contingent on behavior, which results in an increase in the future probability of that behavior. And I've mentioned before that when we are talking about positive or negative, whether it be reinforcement or punishment, positive does not mean good, right? When you hear the term positive, that does not mean something good. It simply means something was added. We cannot consider our own biases on whether something is good or bad. What's good for one person might not be for another person, right? So when you hear the term positive reinforcement, don't think good, something good was added. Think addition, the addition of some stimulus, and the addition of that stimulus after behavior is what results in an increase in the future probability of that behavior. All right. And another thing that to keep in mind is reinforcement is always going to be referring to a principle in which behavior increases. Okay. So if you see a example on an exam that's talking about the future probability of a behavior increasing, or a behavior that increased as a result of some stimulus that was provided after behavior, well, then you're looking at reinforcement. So let's look at some basic examples of positive reinforcement. And these are 2-term contingencies. We're just looking at the response and the stimulus that follows the response here, okay? So the response and then the stimulus that follows the response, and then we're going to look at, well, what happens to the future probability of the behavior, okay? So the first example says you hold a cup under tap and you push a lever, right? Like, let's say you're trying to get water from a refrigerator. You hold the cup under there, you push the lever, and what happens? Well, the cold water flows into the cup. So as a result of this, the future probability of the behavior increases, okay? If this hadn't happened, you're not going to continue to engage in that behavior. So this stimulus acts as a reinforcer and increases the future probability of that behavior. All right. And if you notice, it was a stimulus that was added to the environment. Okay, let's look at the next example. You turn your head and you look left. You see colorful bird. Okay, so there was an addition of a stimulus. So in the future, when you you're more likely to turn your head and look left. Why? Because you're likely to see a colorful bird. And that's it. This stimulus here functioned as a reinforcer to increase this behavior of turning your head and looking left. So those stimuli that are presented following behavior are positive reinforcers, right? And those two examples that I just gave you guys, those were stimuli that were added to the environment contingent on behavior that resulted in the increase in the future probability of that behavior. So those stimuli are referred to as positive reinforcers. And when I say that a reinforcer affects the future probability of a behavior, well, I'm talking about that behavior being altered in some dimension. It doesn't only have to be the rate that increases or the frequency that increases. It could be an increase in the duration. It could be an increase in the latency. It could be an increase in the inter-response time, right? The dimension is changed in some way, and the direction in which it's changed, it's an increase. So the magnitude of the behavior can increase, or the topography of the behavior, okay? So these are different ways that reinforcement can alter behavior. It's not just the rate or the frequency that's modified. When you're implementing reinforcement, there's several factors that you want to consider that will help you achieve a better quality reinforcement. Okay, so one of those things is immediacy of reinforcement. And basically, you want your reinforcer to be delivered as close as possible to right after the response in order to strengthen that response. We don't really want there to be like a delay between the response occurring and then the reinforcer being delivered. We want those two to be as close as possible. So like within 1 second or less, you should be delivering reinforcement. There's going to be instances in which you can't deliver reinforcement that quickly, but you have to know that if you don't deliver reinforcement that quickly, then the likelihood of you reinforcing the appropriate response is going to just decrease and decrease. You might end up inadvertently reinforcing a different response than the intended response that you wanted to reinforce, okay? There are some situations in which a delayed consequence can reinforce the behavior of interest. So there are going to be situations, for example, in which a person can follow rules, or a person has like verbal language enough to understand contingencies that you tell them about. So that is what a rule essentially is. It's like a verbal contingency. So then they can receive that reinforcer at a later time and understand that that reinforcer was being provided for a particular behavior that they engaged in. So an example of this, like you guys yourselves go to university. What are you going to university for? You're going to university in order to get good grades. You're going to university in order to get a diploma at the end. How do you even know that that is a reinforcer that's coming, right? You know because someone explained that contingency to you guys. So those are examples of you guys working towards delayed reinforcers. But it's difficult for maybe like a young 2-year-old or a person that doesn't have that complex verbal language to understand those delayed consequences. And so those delayed consequences for those individuals might not function as reinforcers. Okay. I see this often in classrooms where a teacher says to a child, at the end of the week, you can get treasure box if you do X, Y, and Z behaviors throughout the week. And they'll set a really good contingency for them. But not all kids are rule followers, right? Some kids are need to experience contingencies in order for that behavior to be affected in some way. So for those types of kids, just simply telling them, at the end of the week, you can get treasure box if you do X, Y, and Z behavior is not going to suffice. They need to come into contact with those contingencies in order for their behavior to be modified, right? So for those types of individuals, a more immediate reinforcer that they can be provided with is more likely to function to increase that behavior. Whereas those stimuli that are provided at the end of the week are less likely to function as reinforcers because they're not immediate, and that behavior of interest is occurring maybe, but it's not being reinforced. So that teacher would have to find a way then to reinforce, or the therapist that's working with them would have to find a way to reinforce that behavior more closely to when the behavior occurs, or provide some stimulus more closely to when the behavior occurs in order to reinforce that behavior. So this goes over what I just explained regarding rule-governed behavior. Rule-governed behavior is behavior that's controlled by a rule, which is a verbal statement of a contingency. And it enables humans to come under the indirect control of temporally remote or improbable consequences. So That's kind of like what I just mentioned. You guys go to school to get good grades, right? Everyone has different reasons that they go to school, but one of them could be to get good grades, and getting good grades is so far removed, right? Like that, getting that final grade on your course is so far removed. But you guys understand rules, you understand contingencies, and that's why it functions as a reinforcer for some of you. So there are some indicators that you can look for to find out if behavior is rule governed. Some of these are that there is no immediate apparent consequence, right? So you see a behavior that's occurring, right? You guys coming to school, but there's no immediate consequence for you guys. That's an example of a rule governed behavior. The response consequence is delayed greater than 30 seconds. Again, this meets that criteria. Behavior change without reinforcement. This means, like, if I were to tell you that you need to do something different in order to gain access to that grade that you're seeking, then you're going to modify your behavior even though you haven't come into contact with the reinforcing contingency. A large increase in behavior occurs following one reinforcement, and then no consequence exists, but the rule exists. So you continue following the rule even though there's no particular consequence that you're coming into contact with. Reinforcement doesn't only affect the future probability of behavior, which we know is that it increases the future probability of behavior. Reinforcement also changes the function of the antecedent stimuli that occur, or the stimuli that are present prior to the behavior that it reinforces. So because those stimuli that occur before the behavior are temporally tied to that reinforcer, well, what happens is that stimulus comes to signal the availability of reinforcement in the future. So those stimuli become what we call discriminative stimuli. You should have learned about discriminative stimuli in your intro to EAB course. I can give you guys an example. So an example of a discriminative stimulus would be like an open sign. Let's say an open sign at Taco Bell. If you see the open sign at Taco Bell and you walk in, you can purchase food, which is the reinforcer. So in the future, when you see that open sign, it's going to function as a signal to evoke those behaviors of going in and ordering food, right? And if that stimulus was not present, you might not engage in the behavior of going in and ordering food. So the stimulus becomes a discriminative, the stimulus of the open sign becomes a discriminative stimulus signaling the availability of reinforcement, which in this case is that you can go in and get food. On the other hand, if you were to have a closed sign, you know, with the closed sign, you aren't able to engage in the same behavior in order to access reinforcers. So when in the presence of a closed sign, you're not able to go inside and ask for food, so you're not going to gain access to that reinforcer. So the closed sign is would be an S delta, which is a signal that that extinction is in effect, right? So you can try to pull on the door as much as possible. You can maybe push the door, you can yank on the door, whatever you might want to do, but you're not going to get access to going into the store, requesting food, and then getting access to food. So the S delta is the open sign, which signals the availability of reinforcement, and then the SD is the open sign, and the S delta is the closed sign. So reinforcement had the effect of creating making the open sign an SD, so like it gave it that function, right? And then the lack of reinforcement made it so that the closed sign is an S delta, or functions as an S delta, which signals that there's no availability of reinforcement. All right. So what I just described, those three terms, those three different stimulus changes, right? We have our antecedent stimulus and the behavior, and then the stimulus that follows, which is a reinforcer. Those three are called the three-term contingency. So what I described in the previous slides was the two-term contingency, but this that we just discussed was the three-term contingency, right? So and I'll just give you that example one more time, is the antecedent, which is the open sign. You see the open sign signals the availability of reinforcement. So you go in, you request food, that's your behavior. And then your reinforcer, or the stimulus change that occurs, was that you got your food. So you gained something. And one thing that we also need to consider with reinforcement is that motivation is going to play a role in whether something is reinforcing at a particular moment in time. So we can use reinforcement to motivate a person, right, in some instances, but that's not always going to work if the person is not motivated for that particular item that you're trying to motivate them with, right? It's possible that they've already had too much of that particular item, so then they might not be interested in accessing it. An example could be, I told my son recently that if he does well at school, I'll take him to Chuck E. Cheese on Friday. Well, let's say that I had just taken him to Chuck E. Cheese on Friday, and that evening I tell him again, okay, bud, if you eat all your dinner, I'll take you to Chuck E. Cheese. Well, this could function to increase his behavior, but guess what? He just spent 2 hours at Chuck E. Cheese, so his motivation for going to Chuck E. Cheese again is probably going to be very low. Well, and for some kids might not have enough of Chuck E. Cheese, right? Like they might want to stay there for even longer. But in my son's case, he's very little and he gets tired. So I think if I were to propose to him to go to Chuck E. Cheese again shortly after having just gone to Chuck E. Cheese, he might not be interested in that. The same goes for like if you offer a person sweets right after they've just had sweets, well, they might be satiated on sweets, so they might not be interested in getting some more sweets. So when you are delivering a reinforcer, you really need to be considerate of the fact that reinforcers have momentary effectiveness, and it's all based off of motivation. If we have not had access to something for a long time, right, if we've been deprived of something for a long time, then that stimulus is likely to function as a reinforcer if we haven't had it for a while. Whereas if you've had access to something for like very recently, then it's less likely to function as a reinforcer in that particular moment in time because you just had enough of it maybe, or you had too much of it, and so you won't be interested in consuming that particular reinforcer. Of course, this is dependent on every single individual and their preferences. So let's talk about motivating operations. Motivating operations are environmental variables that have two different effects on behavior. They have the effect of altering the effect of a particular stimulus, so they alter their value. And then they also have the effect of altering the frequency of a particular behavior that has been reinforced by those stimuli. I'm going to break this down for you because it's it sounds a little bit complex, but I promise you it's not. And it's really important to have a good understanding of motivating operations. So if you recall, in the previous slide, I talked to you guys about the SD, response, and then reinforcement, positive reinforcement, right? That contingency, the plus. Okay, that's a plus sign. Whoops. It's a little hard to tell. Hold on, I'll fix it. Okay, I'm sorry, I'm having a hard time erasing that. Okay, so we have our SD, response, and then reinforcement contingency. Okay, and I just mentioned to you guys that there's this other variable, this other environmental variable that we need to consider that is also having an influence over our behavior. So simply because the open sign is present on the door does not mean that I'm gonna go in and request food. Sure, the open sign, right, that example that I've been talking to you guys about, the open sign is the SD, that's signaling to me the availability of reinforcement to then go into the restaurant and request food. But that depends on me being actually motivated for food, right? So I have to first feel motivated for food in order to then go inside the restaurant, to then request food and get the food and consume it, right? So there's this other variable. That other variable is the MO, okay, motivating operation. I just mentioned to you guys, MO is an environmental variable that is present that can have two different effects on the behavior. It's going to alter the value of our behavior, of accessing a particular reinforcer. So like I just mentioned in the example to you guys, the motivating operation is going to be me being hungry. Me being hungry is going to depend, is what's going to alter the effectiveness of a reinforcer. Essentially, it's going to alter the value of the reinforcer for me. So if I'm hungry, I am going to want to get access to food. It alters the value of gaining access to food. If I'm not hungry, guess what? Am I going to go get food? No, if I'm not hungry, there's no point in going to get food, because why would I consume food when I'm not hungry? Maybe I just had a full meal. Okay? So the MO is going to alter the value of that particular reinforcer, meaning it's going to make it more or less likely for me to want to engage in behavior. If I'm hungry, my likelihood of then going and getting access to food or going and seeking out food is going to be higher. If I'm not hungry, my likelihood is going to go down. So it's going to modify my future frequency of behavior, or that actually it's going to modify the frequency of my behavior in that particular moment. So it's momentarily modifying the frequency of behavior, and it's going to alter the value of that reinforcer for me. And by the way, it's only modifying the frequency of the behavior that gives me access to that reinforcer. So it's only going to momentarily modify the frequency of this behavior. So in the example of what was that I said? So the open sign, then I get, that's the SD, right? Let's say I'm hungry. Oh goodness, I wish I had a better way to write on here. I'm so sorry, guys. Hunger. This doesn't even look like the word hunger. Okay, so we're hungry, right? I'm hungry, and then I see the door open sign. I'm going to engage in the response of pulling the door, so I'll pull the door, and I'll request food. Pull door, it could be 2 responses, that's fine. And then that gives me access to food, right? Okay, so I'm going to walk you guys through this again. So because I am hungry, the hunger is going to increase the value of the food, right? I'm going to want to get access to food, which is then going to momentarily increase the likelihood of me engaging in this particular behavior. If I was not hungry, food is not going to be valuable for me, and guess what? I'm not going to engage in that particular behavior. So motivation is going to change whether we engage in a particular behavior or not, and whether we try to gain access to a particular reinforcer or we do not. So it's going to alter the value of a reinforcer. It has a value altering effect, and it's going to alter the behavior. So it has a behavior altering effect also. You guys need to know this. You will be tested on these terms, behavior altering effect and value altering effect, on the BCABA exam. I hope this helps to clear that up. So there are 2 types of motivating operations. I just described them to you, but now I'm going to break them down to you by terms. We have our establishing operations, and then we have our abolishing operations. Establishing operations are those MOs that are going to increase the effectiveness of a reinforcer in that particular moment. Okay, so an example of an establishing operation, or in the abbreviation for it is an EO, an example of an establishing operation would be being deprived of food. So deprivation increases the value of food, and then also increases the likelihood that then we'll engage in behavior to gain access to that food. And then we have our abolishing operations, which the abbreviation for that is an AO. And an abolishing operation is event that's going to decrease the current effectiveness of a reinforcer. So an example of this would be being satiated of food. You've just eaten enough food or too much food, and so you're not likely to then want to gain access to that reinforcer, and you're not going to engage in behavior to gain access to that reinforcer. So here in this figure, we can see that breakdown of those 4-term contingencies. They're highlighting, this example highlights an establishing operation within the 4-term contingency. So remember, the establishing operation is the one that is going to increase the effectiveness of a reinforcer. So let's look here. We have, in this example, our EO is water deprived for 2 hours in a hot, stuffy room. So if you have been in a hot, stuffy room for 2 hours without water, then guess what? You're going to be more likely to want to gain access to water. So then you have your SD, which is going to signal the availability of the reinforcement. So you see blue tap on white on a water cooler. So you see a cooler where you can get water. And then you hold your cup under the tap and push the lever. That's the response, which results in you getting water. So cold water flows into a cup. Guess what happens? Your behavior is going to increase in the future when you are under similar conditions, right? When you are deprived of food, or when you, of water, and you are thirsty, or maybe when you're in a hot room or you feel hot. Let's look at the next example. A park ranger says, after our hike, anyone who describes the bird that makes this chirping sound will receive a $5 token for the gift shop. So in this example, the park ranger describes a contingency that the people can engage in order to gain access to money. And it's likely that this person had a need for money. And so the SD in this case would be hearing the chirping sound, right? Hearing the chirping sound to the left. They engage in the response of turning their head and looking to the left, and they see a colorful bird. And so in the future probability of that behavior of turning their head to the left, turning their head and looking to the left is going to increase. So when we look at the definition for reinforcement, reinforcement is when a stimulus is provided contingent on behavior, so following behavior, which then increases the future probability of behavior. And I explained to you guys that these contingencies can either be explained to people, or they might just be something that a person experiences, sometimes knowingly, right? Sometimes we know when our behavior is being followed by some particular consequence, and we can recognize that our behavior is being changed in the future. Or there are situations in which we don't know that our behavior is being modified in any way, right? We don't have to be aware of the contingencies at play in order for our behavior to be modified. So this is a concept called automaticity of reinforcement. And this is when a person's behavior is modified even though they don't know the contingencies that are at play. They don't have to understand or verbalize the relation between their action and then the reinforcing consequence in order for reinforcement to occur. So we are able to reinforce behaviors without explicitly telling that person, or without, even within ourselves, like our behavior is modified in ways where, like, sometimes we don't even know what the contingencies at play are. So this is something, that you might want to keep in mind when you're working with your clients. There are some individuals that we can keep them in the loop, and we can explain contingencies of reinforcement to them. You can explain rules to them, but just because a person cannot understand or doesn't have the self-awareness to understand those contingencies at play, or the verbal language to understand the breakdown of contingencies, doesn't mean that reinforcement is not going to work. Reinforcement occurs from a very young age. We see this even with, like, a child that looks up at their mom, and then their mom smiles at them, and that smile reinforces that interaction. Like, that's occurring without that child knowing that that's occurring, and we are then reinforcing their behavior of looking back at the mom and making eye contact or engaging in some joint attention with the caregiver. Okay. So just the same way that we can have contingencies that are at play within our own behavior that we're not aware of, right? The process of reinforcement is still going to continue to occur. Well, there is something else called arbitrariness of the behavior selected, which is basically that our behavior is going to, basically whatever is occurring close in time to when reinforcement is delivered is the behavior that might be reinforced. So we have to, let me see if I can rephrase that in a different way so that it's easier to understand what I'm trying to say. Basically, reinforcement, I've mentioned the temporal relation between when behavior occurs and when reinforcement is delivered is very important, right? The behavior that the behavior that occurs closest to when reinforcement was delivered is the one that's likely to be reinforced. This kind of ties into the automaticity of reinforcement. We don't need to know that reinforcement is occurring for our behavior to be reinforced. Well, similarly, because we don't know that when reinforcement is occurring, we can have situations in which a reinforcer is delivered closely in time to another behavior that was maybe not the desired behavior, and instead that's the behavior that gets reinforced. That's what we mean by arbitrariness of the behavior selected. It's that sometimes there's going to be situations when we reinforce some arbitrary behavior that maybe was not the behavior that was intended to be selected, basically, or the behavior that was intended to be increased. This is something that we see really often. A lot of people have like superstitions, right? They have like superstitious behavior that they engage in. Oh, right before I leave the room, I have to tap on the wall. Or, my grandmother always says to me, you need to make sure that you wear your shoes or else your ovaries are going to hurt. And that's a form of superstitious behavior. And just like those different examples that I just gave, there's a myriad of superstitious behaviors that people engage in all the time. But it's really interesting when you analyze the contingencies at play, like how did those superstitious behaviors come about? And the way that it came about is by this arbitrariness of the behavior selected, right? What happens is that at some point, reinforcement was delivered, maybe non-contingently, so not on like a fixed schedule. And reinforcement was delivered close in time to some other behavior. And what happens was that behavior was increased. So we end up reinforcing behaviors and contingencies that don't necessarily have any truthfulness to them, right? They're kind of like correlations that occurred, but those are the ones that get reinforced. So I have a link down here for you guys. Unfortunately, I'm not sure why, but when I try to play videos on my presentations and then I upload the videos, for some reason the videos don't play. So what I've done was I provided the link for you guys. If you go to the PowerPoint presentation that I provided you guys with, the PDF version of the PowerPoint, you'll be able to click on the link, go on that video so you can understand a little bit about superstitious behaviors and how these arbitrary behaviors get reinforced. Like, why do we engage in these random kind of illogical behaviors? And how do those kind of maintain over time? Like, why are they passed down from generation to generation also? And the video that you're going to see is specific to an experiment that was done on pigeons, where they were able to train pigeons to like engage in these random or arbitrary responses based off of delivering reinforcement at a random schedule. All right, so now we're going to jump into looking at different sources of reinforcement. We have two different sources of reinforcement. We have behaviors that are automatically maintained. And then we have behaviors that can be socially mediated, right? Let's talk about the distinction between those two. Behaviors that are socially mediated are behaviors that we've kind of been talking about a little bit, which are behaviors that receive reinforcement through somebody else, right? They continue to occur because there's some contingency that somebody else is controlling. So for example, you get pulled over by a cop for speeding, and you get a ticket. That is behavior that is socially mediated, right? You're going to reduce your speeding simply because somebody gave you a ticket. Or a baby that looks at the mom and the mom smiles back to them and they continue engaging in this back and forth interaction. That's behavior that's socially mediated. That baby cannot engage in a back and forth interaction with a caregiver if that caregiver wasn't responding to them. So there are behaviors that are socially mediated, right? That they receive reinforcement through somebody else, the action of someone else. And then there are behaviors that are automatically reinforced. And automatically reinforced behaviors are behaviors that they don't require the consequence to be delivered by anybody. The consequence is delivered by the individual themselves. And they're behaviors that continue to occur when there's no apparent or clear reinforcer. But this is not to say that all behavior that there is no apparent reinforcer for or clear reinforcer for are all automatically maintained. There can be some behaviors that are socially maintained or socially mediated, but where it's difficult to identify the specific reinforcer that is maintaining it. So we're going to start looking at some examples of automatically maintained behaviors. There are some automatically maintained behaviors that are harmless. We all, I guarantee you, every single one of you listening to this lecture right now engages in some form of self-stimulatory behavior, automatically reinforcing behavior. I definitely do. I engage in hair twirling. I play with my fingers a lot. I rock my leg. I shake my leg. There's people that they rock themselves back and forth as a form of self-soothing. So all of these are examples of automatically reinforcing behaviors or automatically maintained behaviors. The source of reinforcement comes from the action itself. There could be, like, for example, the person that bites their nails might bite their nails because it alleviates maybe some feelings of stress, or they might bite their nails because they don't like the appearance of long nails, let's say. That could be another source of reinforcement for them. There are people that might bite around their nails to remove the cuticles from around their nails. So although a behavior is automatically maintained or automatically reinforced, we could sometimes pinpoint the exact source of reinforcement. And this is important for when we want to manage or reduce an automatically maintained behavior. There are behaviors that, like I mentioned, are harmless, where we wouldn't want to intervene on those behaviors. And then there are behaviors that are harmful, right, where it's dangerous to the individual or it's dangerous to other people around them. And so then those behaviors we might want to target. Or there are automatically reinforcing behaviors that maybe are harmless in the sense that they're not causing any physical harm to the individual, but maybe they're impeding learning. And so if they are impeding learning, then we would want to teach a more appropriate alternative to that behavior so that they can continue to learn. So we're going to talk about some examples for that as well. So an example of a harmful behavior where we might want to intervene on that behavior would be like head hitting, for example, or any form of self-injury, even nail biting. If nail biting leads to cuts, frequent cuts, then maybe that would be something that we might look at addressing or intervening in. So head hitting would be one, nail biting would be one. I'll give you an example of a client that I've seen previously. It's not someone that I worked with directly, but there was an individual that engaged in very frequent, how do I phrase this behavior? They passed their finger over their nose at a very high frequency. It was a low intensity behavior, like she wasn't grazing her nose super hard or anything like that, but she would pass her finger over her nose hundreds and hundreds and hundreds of times per hour. And this ended up like causing tissue damage around her nose and eye area to the point where her eyes were like getting swollen and they were like shutting from how swollen they were. So obviously this is like a concern. She was putting herself at risk, her vision at risk. And so this is a behavior that, although automatically maintained and at a low frequency, wouldn't be a concern. At a very high rate like that is definitely a concern, and we would want to intervene on a behavior like that. Hair twirling is not something that we would want to work on. I remember when I was in college, I had a small chemistry lab that I would attend, and there was a classmate of mine that she would twirl her hair very, very often, but she was engaged. She was constantly attending to the class, responding to questions, and the professor yelled at her one time and said, "Can you stop doing that?" So maybe it was distracting, but it wasn't distracting to anybody else. Maybe it was distracting to the professor, but it wasn't distracting to anybody else. It wasn't causing harm to her. It wasn't interfering with learning. So as an interventionist, as a behavior analyst, this is a behavior that you would really question the social validity of. And you probably wouldn't want to intervene on that particular behavior. There's not really social significance in that case. Although it was bothersome probably to the professor, it wouldn't really qualify as a behavior or meet the qualifications for a socially significant behavior. It's not going to improve the quality of life of that particular person. So now let's look at some possible interventions that we have that are going to help us to either address automatically maintained behaviors or find some other sources of reinforcement for those automatically maintained behaviors. We might look at also finding alternatives instead for that behavior, like an alternative replacement. So before I jump into talking about the different possible interventions, though, I want to mention I want to talk about some ethical considerations when we are going to intervene on automatically maintained behaviors. There are going to be situations, like I've said, where, I mentioned that if the behavior is harmful or if the behavior is impeding learning for the individual, then sure, we can intervene on the behavior. But there are going to be situations where you're going to come across an individual that engages in a particular behavior that's not necessarily harmful to them or to anybody, really. It's not stopping their learning, like the example that I gave you for my friend that twirls her hair in class, but that maybe you feel inclined to work on or pressured to work on because of the caregiver, or maybe because of the professor themselves, the teacher themselves, whoever it might be, the different stakeholders in that individual's life. But that's not a good enough rationale to work on a behavior. Some other ethical considerations, some of you may already be aware of this and some of you may not be aware of this. There is a very big community of autistic individuals that have been through ABA services before and have come out, advocating for other individuals on the spectrum and saying that the ABA that they have been through is abusive, that they were taught to suppress their who they are, that they've been taught to mask certain features about themselves. And that they've been, like, people have tried to make them, behavior analysts have tried to make them fit into this perfect box of what a neurotypical individual should look like. But this is a very valid point. I've been around in the field of ABA for a while. And when I was in school, we were taught interventions in a very black and white format. We were taught these are the 4 functions of behavior. Behavior can be maintained by attention. Behavior can be maintained by escape. Behavior can be maintained by access to tangibles. And behavior can be automatically maintained. And then they would delineate exactly the interventions that go along with every single function of behavior. And they would say, these are the interventions. If behavior is maintained by attention, then we need to use planned ignoring. And I'm sure the professors didn't intend for things to be taken so, like, black and white. Right? But that is how people were applying the knowledge that we were gaining. People were intervening in ways that were so black and white, and they weren't considering the individual. They weren't considering, the ethics of intervening on a particular behavior. A lot of the behaviors that people were working on in the past were more about appeasing the caregivers, about making the caregivers feel more comfortable, or the teachers feel more comfortable, about making this child fit into this perfect little box of, like, normalcy. But the truth is, these are the people that we're working with are people from diverse populations. A lot of times the people that we work with have some form of developmental disability or intellectual disability or whatever it might be. And the truth is that we don't have to make people be like neurotypical. They're not, right? Like, everyone is different. Everyone has their own individual differences, and we have to embrace those differences and then just teach skills to help them maybe communicate more effectively, or to be able to advocate for themselves, and teach skills so that they can function more independently in their day-to-day lives, right? These are the types of skills that we want to teach individuals. We don't want to teach individuals we don't want to take away the individuality, basically, away from people. So although this group of autistic individuals that has come out, and has very strongly advocated against ABA, it has negatively impacted our field in the sense that like now there's caregivers that are afraid to put their children through ABA services because they're afraid that they're going to be putting their children through abuse. That's one of the negative impacts of, this advocacy. But the opposite end of that is that these individuals that have come out and have said ABA is abusive have paved the way for a really big change in our field, a more ethical practice in our field, a more compassionate practice in our field. So in that sense, I'm really, really happy that people have come out and they've talked about their experience with ABA. It's unfortunate that, what they experience is extremely unfortunate, and I don't doubt that they have experienced these things that they're talking about. I think ABA has improved a lot, and it has still more to improve. But I'm hopeful that, with you guys as a new generation of behavior analysts, you guys will take these interventions and not apply them in a black and white format, that you'll be critical thinkers, that you'll be the individuals that will think about, hey, is this behavior harmful to the individual, or that you guys will serve as advocates for your clients. So that if a parent wants you to work on a behavior that is not harmful or that is not impeding learning, then you'll say, you know what, let's consider working on a different behavior that is going to improve their quality of life. I know that this behavior might not be like, a typical behavior that other people engage in, but it's part of who they are, and we should learn to accept that. I hope that you guys serve as this sort of like liaison to kind of help those parents learn that instead of trying to change your child, we should try to be a little bit more accepting of some of their differences. That's just my little ethical tidbit that I'm going to throw into this lecture, and I hope that you guys take it with you and you apply it with you in the future. Please, whenever you're seeing something, an intervention, you're reading about an intervention, you're reading an article, just know that that intervention was appropriate maybe for that particular individual that they did the study on. It doesn't necessarily mean that it will be applicable to your particular client. Based off of all of the different things that we've talked about in our previous lectures, based off of social validity, social significance, right? So it's important that you tailor your treatment plans, that you tailor your interventions to your specific client. This is not a one-size-fits-all. Okay, you might have the most perfect intervention in your mind that's going to work for a particular behavior, and it's not going to be a good intervention for that particular client. Maybe the parents can't carry it out, maybe the teachers can't carry it out, whatever it might be. So just ethical considerations that I want you to think about as you are continuing through this course and any future ABA course. All right, now we'll jump back into the topic about automatically maintained behaviors and then some possible interventions. So number 1 says that we need to eliminate medically based establishing operations. And I'll give you guys an example of this. Let's say that you have a client that you're working with that scratches themselves really often, maybe to the point of causing little scratches or little cuts on their skin, or maybe big cuts. We don't really know. But, this would be a behavior that we might want to work on, or the parent might bring up to you as a concern. And so our responsibility, our ethical duty is to, number 1, always see if there's a medical rationale for behavior. If there is a medical rationale for behavior, we should not be implementing any form of behavioral intervention until that medical concern has been addressed. Okay, this is something that you guys need to know. And actually, if you're going to sit for your BCABA exam also, you're going to notice that when you answer some of the questions on the BCABA exam, there's going to be 2 answer choices that are very similar, and that both of them seem like they could be the correct choice. But in the end, it usually comes down to, is there a medical reason for behavior, or is there some medical rationale that needs to be addressed first? If you do come across that situation, just know that our responsibility as behavior analysts is to make sure that we are addressing medical concerns first. So the example that I just gave you guys about scratching, a child that maybe is scratching themselves very frequently, they might have a medical condition like eczema. And it wouldn't be appropriate to implement some form of behavioral intervention for scratching. Like, let's say that you decide to punish that behavior. How unfortunate would that be? That would be awful and incredibly unethical, because there's a medical need for that behavior. Their skin is itchy. Can you imagine if someone prevented you from scratching your skin when you're itchy? Like, you wouldn't be able to think about anything else. You would just want to scratch. And so that's something that you guys always want to eliminate first. Eliminate medically based establishing operations, so that there is no need for that child to engage, or that individual to engage in that behavior anymore. Next, we can try sensory extinction. And remember that I mentioned to you guys that these are possible interventions. This is not like you're gonna find a behavior that a child engages in, or an individual that you're working with engages in. I always say children because that's what I work with, but you guys might not work with children, and that's okay. But when you are implementing this intervention, sensory extinction, it's because you've found that it's appropriate to that particular client that you're working with. So an example of this could be, I told you guys about the little girl that would touch her face very frequently. In that particular case, maybe something like a glove could be effective if her behavior is maintained by stimulation in her fingertips, or if the behavior is maintained by the sensation of touching on the face. Well, then maybe there's some form of like protective equipment that we can put on her face to prevent her from getting that stimulation. This is what we would call sensory extinction. So it's like you're preventing them from getting that stimulation that they're seeking out, which is what's reinforcing the behavior, right? Extinction is when we withhold reinforcement. So if let's say you are biting your nails because you like the feeling that it gives you on your fingertips, well, then if you were to wear a glove, then you can't get access to that reinforcement. We are withholding reinforcement. So that's an example of sensory extinction. Number 3 is that we can implement differential reinforcement of an alternative behavior. This is an example. This is an intervention that you would use when there is a more appropriate behavior that you can teach to replace that particular behavior of concern. So an example of this would be, let's say that you have a child that engages in throwing of items very often. They're like anything in there and that's in front of them, they're throwing, maybe they're throwing it into a bin or something. Well, this individual can be taught to instead engage in appropriate play that involves throwing, right? So we're giving them that, we're still allowing them to access that source of reinforcement, but in a more appropriate context. So you would be satiating. What we would be doing is essentially presenting like an abolishing operation. We would be satiating their need to throw so that they don't have to throw anymore in the future in that like inappropriate form of the behavior. If necessary, we would consider punishment. Again, I've talked to you guys about ethical considerations. Punishment is not an intervention maybe that you would want to use as your first intervention, but if you're not able to find a source of reinforcement for the particular behavior, then punishment might be an appropriate intervention. This might be appropriate for a behavior that's severe, like for example, head hitting, right? Where they're at risk of causing possible damage, brain damage, or getting a traumatic brain injury. And the risk of a traumatic brain injury is much greater than the risk of punishment. And so for those individuals, maybe if we don't know the source of reinforcement for head hitting, then we would possibly consider punishment. But first we want to try to find the source of reinforcement. A behavior like head hitting could be maintained by like alleviation of a headache, right? Maybe the person is hitting their head because every time they hit their head, they get some form of relief from a headache, meaning that there was some medical need for that behavior or some medical rationale for that behavior. And so this kind of takes us back to number 1. For a behavior like that, we would want to address, medical concerns first. Like, is there a medical reason that this person is engaging in this behavior? If they are, then we need to address that first. If there isn't, we ruled out all possible medical reasons, then maybe punishment would be something that would be okay to use. But you have to do your due diligence and figure out first which intervention is going to be the most appropriate. And then finally, we can use a possible treatment package. It's it's very rare in behavior analysis where we use only one intervention. Often what happens is we use a combination of interventions. So we might do, for example, differential reinforcement of an alternative behavior, and we also might try some sensory extinction for the behavior of concern. Or we might do like a different type of differential reinforcement of an incompatible behavior, whatever it might be. Okay, so now we're going to talk about two different types of reinforcers that might exist. We have conditioned reinforcers and our unconditioned reinforcers. These are both terms that you should already be familiar with, so this is just a review. Our unconditioned reinforcers are reinforcers that are inherently, without having prior learning history, are already reinforcing. Okay, these are things like water. These are really things that are necessary for survival. These are things that like water, like warmth, oxygen, sexual stimulation, and for some people also the human touch is an unconditioned reinforcer. Okay, these are again unlearned reinforcers that these are stimuli that once they follow behavior, they'll increase the likelihood of behavior as long as there is a motivation for them. Okay, again, all reinforcers are the value of a reinforcer is going to change based off of motivation. Once you've had enough water, well, then you're not going to be motivated for water. Okay, so it's something to consider. And then we have our conditioned reinforcers, and our conditioned reinforcers are stimuli that were once neutral. They didn't produce any change in our behavior, but over time they were paired with other stimuli that were reinforcing. And so these stimuli, through stimulus pairing, have acquired a reinforcing function. So they then become conditioned reinforcers. And this could be anything. So if you like, for example, chocolate could be a conditioned reinforcer for you. The use of your phone, if you enjoy using your phone, it's possible that your phone might function to increase behaviors. So a conditioned reinforcer really could be anything, and it is all going to be dependent on the particular individual and their own preference for items. But remember, preferred items don't always function as reinforcers. A reinforcer, by definition, is something that functions to increase our behavior in the future. Then we have generalized conditioned reinforcers. Generalized conditioned reinforcers are conditioned reinforcers that don't depend on motivation in order for the item or the stimulus to function as a reinforcer. So this is ultimately what we want. Every single one of our clients that we work with, we want them to have some form of generalized conditioned reinforcers. This is something that we work towards. An example of a generalized conditioned reinforcer could be praise. Praise is a really big one. Praise is something that, regardless of your motivation for a particular item, you're still going to be interested in praise if praise functions as a reinforcer for you. Praise does not function as a reinforcer for everybody. There are some individuals where praise is actually a punisher for them. So, but it's just an example of a possible generalized conditioned reinforcer. If praise functions to increase my behavior, across different behaviors, regardless of motivation, then that would classify as a generalized conditioned reinforcer. For example, let's say that my boss at work gives me praise, and that increases that behavior at work. And my mom tells me, thank you for doing the dishes, and that increases that behavior of doing the dishes, right? The reinforcer, the stimulus itself, the praise statements are not dependent on any particular establishing operation. I don't have to be deprived of praise in order for praise to function as a reinforcer. So that's what makes it a generalized conditioned reinforcer. Eye contact can be another generalized conditioned reinforcer, and then so can tokens. So if you're already practicing in the field, you're probably familiar with what a token board is. Tokens are forms of generalized conditioned reinforcers. If you've seen star charts that teachers use in classrooms, those little stars that they're delivering, that's a form of generalized conditioned reinforcement. those things eventually are exchanged for something else, right? Like they're exchanged for some backup reinforcer, but the stars themselves function to reinforce a lot of different behaviors regardless of motivation in that particular moment. There are some different types of reinforcers that we can have or that people might be motivated for. Some people might be motivated for every single one of these or by only a few of these. So you have to be considerate of your individual client preferences, or not their preferences, but you have to consider what's going to function for that particular client. So here are some forms of reinforcement. We have edible reinforcers. Edible reinforcers are things like food or consumables, like a drink. You could call it. It's not really a drink. It's not something that you eat, but it's something that you do consume. So you can consider that an edible reinforcer. So it's like something to snack on, sips of a drink, right? Those would be considered edible reinforcers. These are stimuli that are functioning to increase our behavior. Personally, I am not a big proponent of using edible reinforcers. I feel that ethically we are not maintaining our client's dignity by using edible reinforcers in all cases. In most cases, this doesn't apply to all cases. There's going to be situations where you don't have good quality reinforcers for the other types of reinforcers. So then, if all we're left with is edible reinforcers and that is very valuable to that individual and it does function to increase behavior, then we might use it to increase communication, and maybe we'll use it to condition other reinforcers. But I'm not a big proponent of the use of edible reinforcers. If at all possible, I prefer to use other reinforcers to reinforce other types of behaviors. Let's see what else. Sensory reinforcers. Sensory reinforcers could be things like tactile stimulation. Some individuals might they might find being in a dark room with pretty lights reinforcing, so you can use that as a possible reinforcer for other skills that you're teaching. Maybe some little sensory toys or playing with sensory bins, that type of stuff might be reinforcing for some individuals. So some type of tactile stimulation could be reinforcing. And if you find that you have a kid that's very motivated by sensory type activities, then you want to incorporate sensory reinforcers into your practice. Next, we have tangible reinforcers, and tangible reinforcers are just like items, physical items that a person can earn after engaging in behavior in order to increase their behavior. These are typically items that they'll play with. So it could be toy cars. It could be the phone is a tangible reinforcer that you could possibly use. I personally don't use phones in my sessions. I don't like to use phones or devices in my sessions with my clients. It's not to say I haven't used them, but in most cases I prefer not to use them. We can use things like, I don't know, if you have a ball pit, maybe they enjoy playing with the ball pit. That's a form of tangible reinforcement. So these are just different items that the individual can engage with that will function to increase the behavior that it follows. Okay. We can have activity reinforcers. An example of activity reinforcement might be, playing soccer after having completed a task, or it could be jumping on the trampoline. It really could be any type of activity that the individual engages in, that you might want to deliver after behavior in order to increase that particular response. And then we have social reinforcers. I love, love, love the use of social reinforcers in my sessions. Obviously, this depends on the client. Not all clients are going to be motivated by social reinforcers. Social reinforcers is for example, tickles. It could be, and tickles might not be appropriate depending on the client's age, by the way. But it could be something like tickles. It could be something like playing, patty cake. It could be something like singing a song along with the client, or maybe just, I don't know, dancing along with them. Whatever it might be, that you are it's an activity that you engage with them socially. I love to use social reinforcers in my session. I find that they're a great way to promote communication. Yeah, I don't know. It's just one of my preferred methods of reinforcement. It also kind of, I feel like when you use social reinforcers, they are less dependent on the delivery of like some tangible item. And social reinforcement is most likely to be delivered in their natural environment. So most people will come into contact with social reinforcement, and that can be carried out more easily across different settings, across different individuals, than it is for someone to carry around toys with them and constantly be delivering toys. Now, I do want to mention every single one of these reinforcers, like you're going to select which type of reinforcer you're going to use based off of your client. Okay, there might be a client that doesn't find praise to be reinforcing, and so, or physical contact to be reinforcing, so then I wouldn't incorporate those social reinforcers that much. I might incorporate them so that over time praise becomes reinforcing and we can maintain their behavior in a more natural way. But that might not be possible at the beginning of an intervention. So just, consider the different ethics of incorporating these different types of reinforcers when you are working with your clients. Now let's explore this concept called the Premack principle. The Premack principle was something that was, it's essentially an idea that was developed by a behavior analyst called Premack. And Premack believed that activity reinforcers were actually like behaviors that people engage in, and that these behaviors could be used as reinforcers for other behaviors. So he basically said we should look at the frequency of the different behaviors that people engage in, or these different activities that people engage in. Let's say that a person likes to play with toys and that they also need to work, but they don't like to work. Well, we can look at the relative frequency of these behaviors, and we can position these different behaviors, the low frequency behaviors and the high frequency behaviors can be positioned in a way where if you make one contingent on the other, we can reinforce that behavior. So the Premack principle is the idea that we can use a high probability behavior in order to reinforce a low probability behavior. Okay, so I'll give you guys an example. Let's say that an individual doesn't like to complete tasks at the table. They don't like to work at the table. That's a low probability behavior. We can make that reinforcer of playing with toys. Let's say that toys is a high probability behavior. We can make the toys contingent on working. So they're only going to get access to the toys after they've worked. So we would use a statement such as, okay, first we work and then we can play with toys. So that's an example of the Premack principle being used. And the Premack principle is something that you're going to use very often if you are working with clients in the field of ABA. We use first then visuals sometimes, or sometimes we just say the statement, first you do this and then you get X, Y, and Z. So all we're doing is we're telling them that the low probability behavior, they have to engage in that low probability behavior first in order to then get access to that high probability behavior. All that Premack is saying is that high probability behavior is going to function as a reinforcer for that low probability behavior, so that in the future that low probability behavior increases. Right. So this chapter also talks pretty extensively on preference assessment and reinforcer assessment. I'm going to very briefly just talk about the two concepts, just what a preference assessment is and a reinforcer assessment is. But these are topics that you will be learning about more extensively in the next course, the next ABA course. It's the assessment and intervention one. Or you might have already talked about it in your intro course as well, because I definitely cover this topic pretty extensively in my intro course. So we'll just be talking again about the preference assessments versus reinforcer assessments. So preference assessments are assessments that we conduct in order to identify items that are preferred and that may function as reinforcers. So like a big emphasis on may function as reinforcers. What a preference assessment allows us to do is it allows us to establish like a ranking essentially of low preferred items to high preferred. We also get like some information on some moderately preferred items as well that we can then go ahead and we can use as possible reinforcers. There really is only one way to test the effectiveness of a reinforcer, and that's by of a preferred item, and that's by conducting a reinforcer assessment. The only way we will know if an item truly functions as a reinforcer is to provide that item or that action or whatever it is, provide that stimulus after a behavior and see if it increases the likelihood of that behavior. So it's a very experimental test that you would be conducting, a very direct test on the behavior to see if that behavior increases. The stimuli that function to increase behavior are those stimuli that do function as reinforcers. So that's what a reinforcer assessment is going to be testing. So the preference assessment helps us to identify preferred items that may function as reinforcers, and then reinforcer assessments are direct assessments or direct tests of those stimuli to see which ones do function as reinforcers. All right, so now we're going to jump into discussing different types of reinforcement procedures or positive reinforcement procedures that we can utilize. And you're going to be using these in your practice and different with different clients. So you need to become familiar with these different procedures, okay? First, we have non-contingent reinforcement. And non-contingent reinforcement is when we present a reinforcer on a fixed time or a variable time schedule, regardless of the behavior's occurrence or not, okay? So you guys should have learned about your schedules of reinforcement and the intro to experimental analysis of behavior class. And you probably learned about interval-based schedules. And an interval-based schedule is a schedule in which after a behavior occurs, you deliver reinforcement. After a certain amount of time passes and the behavior occurs, you deliver reinforcement. Well, a time-based schedule is slightly different from that. With a time-based schedule, we deliver reinforcement after a certain amount of time has passed, but the behavior does not need to occur. Instead, we just deliver the reinforcer. So let's say like this would look like if I were to say that every 3 minutes I'm gonna deliver a toy, let's say, to Jimmy. So every 3 minutes I give Jimmy a toy, regardless of whether or not he's engaging in behavior to gain access to that toy or not. Okay. Or an example of another time-based schedule, this would be that example that I just gave you guys, if I said every 3 minutes would be a fixed time schedule. A variable time schedule would sound something like this. On average, every 3 minutes, we are going to provide a toy to Jimmy. And then that's, again, regardless of whether the target behavior occurs or not. So maybe in this case, in this example that I'm giving, maybe the behavior could be maintained by gaining access. Maybe Jimmy engages in aggression in order to gain access to tangible items. Well, if that were the case, then I can use non-contingent reinforcement to provide access to that reinforcer without him needing to engage in that maladaptive behavior. He doesn't have to engage in it. Basically, what we're trying to teach him is that he doesn't have to engage in aggression in order to gain access to this item, because we're going to provide access to the item regardless. So what it does is it satiates the need or the desire for the item. Where non-contingent reinforcement works on removing the establishing operation for the behavior by providing access to that reinforcer very often. Another example of non-contingent reinforcement is an example that I gave you guys earlier. So I talked to you guys about, like, let's say an individual that throws items very frequently, maybe because they find it to be automatically reinforcing. So they throw items very frequently into containers. Well, I can provide them access to those activities, to throwing, but through an appropriate activity. So I could provide access to throwing activities multiple times throughout the session. Instead of basically what I'm going to try to do is I'm going to try to satiate the desire for engaging in throwing. So let's say that I might tell my therapist, every 10 minutes, we're going to stop what we're doing and we're going to go and have him play an activity that involves throwing. So we might have them go play basketball, or we might have them throw items, like let's say the bowling ball at the bowling pins. I don't know, different activities that would involve throwing of balls, or throwing of objects to satisfy that desire. So what's going to happen is, since we are providing access to that reinforcer non-contingently, we are going to be reinforcing appropriate throwing, or like appropriate play activities. And instead, what's going to happen is that other behavior, which is a throwing and, like out of context, that behavior is likely to then go down or stop occurring. Because it's the throwing itself is not going to stop occurring. It's the throwing out of context, or not an appropriate play activity, that's going to stop occurring. But instead, we're going to be reinforcing that behavior of engaging in appropriate play. One thing that you need to be aware of when you're implementing non-contingent reinforcement is that since you're providing reinforcement on a time-based schedule, you run the risk of inadvertently reinforcing the target behavior on a intermittent schedule. So the behavior the problem behavior might persist simply because the individual is accessing reinforcement sometimes for the behavior. Although you're not necessarily delivering it with that purpose, it might line up. So it might line up in a way where the when you're supposed to deliver reinforcement, the behavior just happened. So it might inadvertently be reinforced. If this does happen, what you can do is just continue to carry out the non-contingent reinforcement. So continue to use your time-based schedule. And then maybe over time they'll realize that you're not providing the reinforcer contingent on their behavior, but instead you're providing it on a time-based schedule, so that they're going to get access to the reinforcer regardless of whether they engage in that behavior or not. All right, so now we're going to look at the other reinforcement procedures that we can implement. We have differential reinforcement of other behavior. And actually, differential reinforcement is a general procedure that we implement in behavior analysis. And there's multiple types of differential reinforcements. We have differential reinforcement of other behavior, differential reinforcement of alternative behavior. There's differential reinforcement of diminishing rates. There's so many of these, but we're going to cover just DRO and DRA today. So differential reinforcement of other behavior is when we deliver a reinforcer when the target behavior has not occurred during a specific interval or at a specific point in time. So basically you're reinforcing the absence of the behavior. So as long as any other behavior has occurred, but not the specific target behavior, then we can deliver reinforcement. So an example of this would be like, let's say that I'm working with a child to remain seated, and the problem behavior is them getting out of their seat. Well, I could use differential reinforcement of other behavior in order to reinforce the them remaining seated. And try to reduce them getting out of their seat. So in this particular case, what I would do is I would probably set a timer, like maybe a 2-minute timer. And I'll deliver reinforcement every 2 minutes if for that whole interval they did not get out of their seat. So after the 2 minutes, I'm going to see, okay, they didn't get out of their seat. Then I'm going to deliver the reinforcer. And I'll do the same thing. I'll start another 2-minute interval. Oh, they didn't get out of their seat. Okay, I'm going to deliver reinforcement. If, let's say, during the third interval, during those 2 minutes, they do get out of their seat at some point, I'll say, oops, sorry, you engage in the behavior, and so we won't gain access to the reinforcer this time. That's an example of differential reinforcement of other behavior. It doesn't matter if on the table they're doing their action, like while they're sitting at the table, they're doing their actual work. It doesn't matter if they were talking to their neighbor, like the person sitting next to them. It doesn't matter if they were drawing. Whatever it is that they were doing doesn't matter so long as they were not engaging in the problem behavior, which was getting out of their seat. Okay. Then we have differential reinforcement of an alternative behavior. The definition, I feel like, is in the name for this one. You are reinforcing an alternative behavior, and we're no longer going to reinforce the problem behavior. An example of this would be, let's say a child that engages in aggression in order to gain attention from their caregiver. Well, we can teach them to communicate more effectively. So I can teach them to say, hey, look at me, or mom, talk to me, or play, or whatever communication response I want to teach. And what I'm going to do is I'm no longer going to deliver reinforcement for the aggressive behavior. So that'll be placed on extinction. So what will happen is we'll see an increase in that desirable alternative behavior, and we'll see a decrease in that undesirable problem behavior. All right, so lastly, to finish off chapter 11, we're going to talk about how to use reinforcement effectively. Number 1 is that you want to set an easily achieved initial criterion for reinforcement. This is something that I really want to emphasize. I think it is crucial for any intervention that you are carrying out to always set your criterion below what that person can currently achieve. So let's say that I'm trying to teach a child to complete a worksheet, and I collect baseline on how much of a worksheet they can already complete, and they can only complete 4 problems out of 10. Well, if I want to get them to the point where they can complete all 10 problems without engaging in any problem behavior, and in order for them to access reinforcement, well, I'm not going to set my initial goal to be for them to complete all 10 problems. That's unrealistic. So what I'm going to likely do is set a smaller criteria, and then I'll build up to the point where they can complete all 10. Personally, I like to go way below baseline, or not like super below baseline, but slightly below baseline. So if they could complete 4 questions prior to during baseline, well, then my first criterion goal is probably going to be set at 3. So what I'm going to do is I'm going to have them complete 3 questions, make it super easy, make it very attainable. And then once they complete the 3 questions, then I'll provide reinforcement. What's going to happen is they're going to be like, oh, this was easy. This was so much easier than what I'm used to. I can do this. We're going to reinforce their behavior. They're going to be feeling good. They're going to be feeling confident. And then I'll increase the criteria. So now, instead of completing 3 questions, once they can consistently complete 3 questions, I'm going to maybe push to, okay, now you have to do 4 questions. And I'm going to reinforce that a few times. And then they're going to be able to engage in that response without engaging in problem behavior. And then when I push for them to engage in 5, it's going to be easier for them. So the next I'm going to push for them to engage in 5 responses. I'm going to reinforce that. And at this point, they've already had a history of reinforcement. They've contacted the contingency. They know the expectation, right? They know that they have to complete this number of questions in order to access the reinforcer. So now they've come into contact with the contingency, and they're more likely to continue on with the plan, essentially. And what I like to do is I like for my initial criteria to be so achievable that they're not going to engage in problem behavior. It's easy for them, and it's like a no-brainer. They're like, it's easier for me to engage in this response that she's asking me to engage in than it is for me to engage in problem behavior. So then I get the opportunity to reinforce that behavior and increase the future probability of that behavior. Next, we want to make sure that we use high-quality reinforcers, or that the reinforcer has a sufficient magnitude. So you want to make sure that you are identifying items that are going to function as reinforcers, and that you're going to be delivering enough of that item. So I like to ask my students all the time, I'm like, if I told you, come work with me, for 1 hour, and I'm going to pay you $100, would you come work with me? And most students tell me, yes, I'll come work with you. Whatever the job is. And then I always ask them the question again. I say, will you work with me if I only pay you $1? Will you work that 1 hour if I only pay you $1? And usually what happens is they're no longer interested in working, right? And the reinforcer didn't change. The reinforcer was the same. The reinforcer was money in both cases. The problem was what changed was the magnitude. So you need to consider how much of a reinforcer are you going to provide? For how long are you going to provide that reinforcer? All of these things are things that will influence whether that person continues to engage in that behavior or not. It's basically a question of, is it worth it? Right? Is this reinforcer that you're providing me with, or the stimulus that you're providing me with, going to be worth it for me to engage in that particular behavior? There's going to be a cutoff point where if you're not providing enough of something, they're no longer going to want to engage in that particular response in order to gain access to that item. You want to use also varied reinforcers. So I talked to you guys about the different types of reinforcers. You want to include maybe some activity reinforcers. You want to include some social reinforcers, edible reinforcers if that's what you use. You want to try to move away from those as much as possible and try to incorporate some of the other more naturally occurring reinforcers. You want to use direct rather than indirect reinforcement contingencies whenever possible. Basically, this is what I was kind of talking about earlier, but you want to basically program for reinforcement that's natural, where the behavior on its own is going to produce reinforcement. That's that direct reinforcement. And then indirect reinforcement is those behaviors that they don't produce reinforcement on their own. There's no naturally occurring reinforcers, and so then you have to provide some form of artificial reinforcement. As much as possible, you want to limit those artificial reinforcers or try to move away from those, whenever you feel that you're able to reasonably make that move towards more direct reinforcement. There are going to be people that are going to rely on indirect reinforcement for a while before you can move into some of these more naturally occurring reinforcers. The next one, number 5, states that we should use response prompts and reinforcement together. This is basically that you're going to teach or prompt that individual in order to be able to gain access to that reinforcer. I have seen situations in which I'm working with a brand new therapist and they'll ask the client a question and the client has no idea, how to respond to that question. And the therapist, instead of providing a prompt, will continue presenting the same question over and over, expecting that they're going to receive a different response. So this can become frustrating for the client. It can prolong, how long it takes for them to gain access to the reinforcer, which is just going to increase frustration and it might lead to problem behavior. So when you are teaching a skill, you want to provide prompts for that, for them to be able to engage in a response if they don't know how to. And then you want to deliver reinforcement for those prompts. So we can deliver reinforcement for prompted responses. And then eventually we'll gradually fade that out so that they're only receiving reinforcement for independent responses. Number 6 states that we want to initially reinforce each occurrence of the behavior. This is really important. When you're teaching a brand new skill, it's important that we maintain an FR1 schedule of reinforcement initially, and then we want to gradually fade that schedule out or thin that schedule out to support a more naturally occurring reinforcement schedule. But when you're first teaching a behavior, the first response that occurs, you want to make sure that you're reinforcing it every single time that it occurs, so that you can strengthen that response. And then once that response has been strengthened, then you can push for a more complex response if you wanted to, or you can not deliver reinforcement for every single instance of that response. Once that response is already in that person's repertoire, and you know that it'll maintain with a thinner schedule of reinforcement. Number 7 states provide contingent attention and descriptive praise. Basically, this is to just make sure that you are providing attention and praise for desirable behaviors. Number 8 is gradually increase the response to reinforcement delay, which is basically to be able to teach that individual to accept delayed reinforcement. Not all forms of reinforcement come immediately, right? There's times I've talked to you guys about rules I talked to you guys about how some reinforcers will come much later. We need to teach people to be able to accept delayed reinforcers, but of course you can't get to that point unless you have built a skill to begin with. So this is something that does take time and that not every one of your clients is going to be able to achieve from the get-go. And then finally, gradually shift from contrived to naturally occurring reinforcers. This is something that I've been talking to you guys throughout this entire lecture, so you should already be familiar with what I mean by that. Okay, I hope that you all enjoyed the lecture and that it was insightful on positive reinforcement.